Welcome. Good day. My name is Sanjoroga Wanjigi, the CEO of Farm Life SA. As you know, we pride ourselves in helping millions feel better daily through our pharmaceutical distributions. But what type of a company would we be if we helped so many outside the company and yet did not take care of our own? Allow me to tell you about our policies to support those with infected and affected by HIV and AIDS, and how to reduce its impact here at Farm Life SA. The HIV virus and its full-blown big sibling AIDS respects no social, age, gender, or racial boundaries, affecting every workplace across the globe. And more than that, sadly, it's still a disease where sufferers face a huge amount of ignorance, prejudice, and discrimination. I believe that these policies will go a long way towards creating a non-discriminatory work environment and help us deal better in HIV testing, discrimination, and disclosure. I'm also going to tell you about how we deal with employee benefits relating to HIV and how we deal with grievances in the workplace. I do believe that these policies will create a safe working environment for everyone here at Farm Life SA through our efforts and procedures in managing occupational accidents and so on. We would like to help you make the best of yourselves while you're still here, whether you are infected by the virus, because the truth is, we are all affected by it all. That's why it's important for management and staff to cooperate fully with the policies, regardless of who you are. In terms of the main values of the policies, I'd like to point out our commitment to promoting equality and non-discrimination, creating a supportive working environment for everyone at Farm Life SA, especially for those infected with the virus. Protecting human rights and dignity for every staff member is vitally important for us. The South African law is very clear about all issues relating to good conduct in the workplace, and we support that 100%. Our policy regarding HIV is obviously in line with the law. For instance, in terms of the Employment Equity Act, we definitely do not support discrimination against anyone, particularly on the basis of their HIV status. Nobody will be fired because they have HIV or AIDS in accordance with the Labor Relations Act. In terms of the law, all staff are entitled to a minimum number of sick days, and no medical aid is allowed to discriminate against you because of your status. You are entitled to privacy. That means you do not have to disclose your status. Should you decide to tell anyone, they should get your written permission before they share it with anyone else. No manager can force you to get tested, even in the company's sponsored testing programs. Farm Life and management would like you to make your working environment safe. Should an accident happen, we will make sure you get post-exposure medication, and we will help you apply for compensation should that be necessary. During the rest of your induction, we are going to give you training and education on how to use proper infection control measures, on helping you deal with HIV and other health risks. Should there be an accident at work, it's important you promptly report the accident so that we can assist you in gathering information to prove that you are infected with HIV-infected blood, should there be a need for compensation. When it comes to staff benefits, non-discrimination once again reigns supreme. HIV-infected employees will not be unfairly discriminated. They will be treated just like other staff members with comparable life-threatening illnesses. We will therefore not use information from medical aids or anything to discriminate against HIV-positive employees when it comes to employee benefits. If it ever comes down to an HIV-positive staff member being unable to perform their duties due to the disease, the normal company incapacity procedures will apply, but without any judgment or discrimination. The same principles applies to dismissal. No staff member will ever be fired from Farm Life for having HIV or AIDS. In the sad event that a staff member is too sick to perform their duties, we will simply follow the Code of Good Practice on Dismissal in Schedule number 8 of the Labor Relations Act. And what's more, if the proceedings are held, that staff member will never have to disclose their HIV status or take an HIV test during the proceedings. At Farm Life, we understand that people with HIV and other life-threatening illnesses need continuous therapeutic assistance in order to do their job to the best of their ability. We are 100% committed to assisting staff in many ways. Therefore, if you realize that you have been infected with HIV or AIDS, you need to get in touch with the company's representative's medical aid in order to get help as soon as possible. We promise that this information is confidential. It is a service we are offering you in order to give us the best, yourself, your families, and the community at large. Farm Life is in agreement with Farm Health Medical Aid. We'll assign you a case manager to manage your health in confidentiality. We will provide an occupational therapist should there be a need for you to discuss anything about your health. Should you be infected, you are entitled to a free HIV testing after 6 weeks to ensure that your ARVs are effective because your health is our concern. After 6 months, there is a further test to check your CD4 count. For those infected and affected, there is an anonymous phone line called Farm Care, wholly sponsored by the company, with counselors waiting for your call at any time. We are confident in this program, thanks to its 80% success rate here at Farm Life SA. There is a lot to discuss when it comes to discussing HIV and AIDS at work, and I believe I have covered the most important parts here. And whether or not you are infected or affected by HIV and AIDS, I am thrilled to have you as part of Farm Life team. Welcome. I'm sure you'll be very happy here.